Good morning, everyone. You are watching Inside Cape Cod. I'm Sarah Colvin. Today, I am pleased to welcome to the studio Stacey Gallagher. She's the director of Children's Cove. Stacey, thank you so much for joining me today.
Thanks for having me.
So, Stacey, tell me a little bit about Children's Cove for people who may not be aware of what your organization does.
We are the Cape and Islands Community Child Advocacy Center. We are a nationally accredited agency through the National Children's Alliance in Washington, D.C. And we see children ages 2 to 17 who have been sexually abused, severely physically abused, witnessed to domestic violence, or now we're also seeing cases of child exploitation and trafficking. We've been in existence for 18 years, and we serve about 200 child victims per year with wraparound services with their other siblings and family members.
And this is an organization, as you said, that's funded by the county. It's a county organization.
It is. We are a Barnstable County department, so we're public-private. We also have the ability to fundraise.
Absolutely. So let's talk a little more in depth about the services that are provided and kind of the need here on Cape Cod. I think, again, this is something that it's a tough topic to talk about. It's something that a lot of people don't like to think about, but it is, it is something that happens in our community. So tell me a little bit about, the importance of having a service like this, especially here on Cape Cod.
Sure. Cape Cod is no different than anywhere else. Child sexual abuse is happening here, and it has been for just as long as anywhere else. We are a needed service. We are the only child advocacy center in the county, and we provide services to Barnstable County as well as both islands. Every county has a child advocacy center, so we're fortunate to have that service through the county. There are over 700 child advocacy centers in the country as well as overseas now, and we're a valuable service to the community members because when a child does disclose sexual abuse or any other abuse, odds are that that case is coming through Children's Cove, and not necessarily just for investigative purposes, but for the healthiest outcome of that child and their family members. So wraparound services for all of the family members when a child victim discloses.
Sure. And when you say wraparound services, do you provide those or do you coordinate with other agencies that can help?
We do both. So we are a model of providing multidisciplinary services to kids and families. So a child will come in from a disclosure. They'll usually come in from law enforcement or the Department of Children and Families. That's not to say that the mom or a caretaker or dad can't call to figure out the route they have to take. And then what we'll do is what's called a forensic interview for the most part, and that's investigative. So a fact-finding, neutral, investigative interview with the child, with the multidisciplinary team present to really find out what happened to this child. They're disclosing a traumatic event. It's not a counseling session. It's really to get the facts for the team, to really maximize the amount of information and minimize the trauma for this child versus going to all those different agencies, going to DCF, going to the DA's office, going to a police station. So 30 years ago when child advocacy centers were formed, it was with that intent to really reduce the trauma for these kids to tell their story over and over again. So it's sort of that one-stop place, child-friendly atmosphere that a child and their family can go to have that conversation and for all the members of the multidisciplinary team to be present.
And I think what you said about reducing the trauma is so important. These are families and children who have already gone through, unspeakable trauma, and so to be able to have to process that and talk about it, I can only imagine how difficult that must be, not just for the family, but for the child, him or herself.
Right, and it's, we really look at the traumatic piece of it too and have wraparound services for the entire family because when this happens to a family, it really tears a family apart. They don't really know where to go, so Children's Cove is there for them to provide those services. And the services that we provide are on site at Children's Cove. So after the forensic interview, they'll come in, the caretaker, whoever brings them in, and we'll meet after the forensic interview and really talk about resources for that family as a whole. We provide family advocacy, which means that our family advocate will follow that child and family from the minute they walk through the door and take an assessment of what the needs really are for them. We have mental health referral services, and that's become really regionalized for us. So we've looked at trauma and said, we used to do clinical work on site, but we looked at it and said, we've got kids coming from Nantucket and coming to Barnstable for specialized clinical services, and it really didn't make sense. So we regionalized our services, and we now provide specialized trauma-focused training to the existing clinicians that are in our community. So then we can refer back to those same clinicians. And from Bourne to P-Town in both islands, we have a really good network that we provide.
Wonderful. Let's talk a little bit about some of the advocacy work, because I think awareness and advocacy is an important part of this, along with the treatment and the wraparound services that you provide. So tell me how Children's Cove kind of works to raise awareness about the issue and help in the advocacy portion of it.
Sure. We've had an awareness campaign for a very long time, and it's really important. When I became director about 10 years ago, the thing I kept hearing is child sexual abuse doesn't happen on the Cape and Islands. And that was really, it really impacted me to the point where I said, we really need to get this out into the community, that it's happening here. So our awareness campaigns are really important to us. You know, we have several radio ads that are out. Hopefully people have heard them. We have print ads that really talk about the issue, because I think people don't want to talk about it, and it's really important to get the word out and to make kids these days comfortable in talking about it, because we didn't talk about it years ago. We need to make it part of the conversation, so it's easier for kids to talk about it and to disclose, because what's happening now is we're talking about teenagers right now and formulating potentially a teen board, because what's happening is there are teen-to-teen conversations. You know, if you can imagine when you're a teenager, you kind of talk to your best friend about it, but it doesn't really go any further than that. So we've realized that there's a gap in services for teenagers to really get them to report in a safe place. You know, the younger kids that are below teenage years, you know, they're more comfortable talking about it, and what we're seeing is after a certain amount of incidents, instead of years, they're reporting. So I think we're getting the word out. And our awareness piece is really important for parents and caretakers. So we talk about our website and having resources on our website to be able to have that conversation with the kids, because people are still very uncomfortable talking about it. So we have resources like we have a cartoon that you can show your kids and at least start the conversation. And it's been really helpful for us. So it's really important to get the word out and make it comfortable for kids.
Sure, and I've heard your radio ads, and I think it's one of the most it always makes me stop and listen, because there's a big period of silence in the PSA, and that's an important part of it. As you said, it's hard for people to talk about, and usually people don't talk about it.
Right.
And it's something that if you deal with it as a child and then get older, it can cause all sorts of problems.
Right.
So let's talk a little bit about awareness and perhaps how people can notice the signs. If you're a friend or a family member or a close acquaintance, and you see something that you might be worried about, what are some of the signs that people should be looking for, or parents even should be looking for?
Yeah, they vary, and they're certainly not all encompassing. So you can look for medical signs of a child. They'll come and talk about redness in certain areas, or potty. When younger kids are potty training and whatnot, but for the most part, the younger kids will tell you if something's really hurting. But if for behaviors, we get a lot of phone calls that parents are seeing potential sexualized behaviors with these younger kids. And is that a red flag, or is it normal development? So we get some of those calls sometimes, and we have to direct those calls, maybe to appropriate services versus an investigative case. I think if kids are really, a change in behavior from what they normally are, definitely, depression and fatigue and slacking off in school a little bit, and just, I think, different behaviors from what you would normally see. If they're visiting, a dad on a weekend or a mom on a weekend, and they just all of a sudden don't want to visit any longer, just looking for signs like that, because it is happening, and I think people just need to be aware that it is.
So is it something that even if folks are concerned that something might be happening, if they call Children's Cove, you can kind of offer some advice?
Absolutely.
And say,
and we encourage that, because it's, parents have enough to worry about in raising their kids, that if they see something, I think we always put out there to have the conversation with us. We can certainly have that conversation or direct them to the people that can tell them this is normal development of a child. It's difficult if they see somewhat of a red flag and they're sort of mulling it over in their head, and they don't know really where to go. So we have them at least call Children's Cove to talk about that. But certainly professionals in the field know to report it to DCYF or to law enforcement. So that's really important to know too.
Absolutely. And for teenagers, I mean, we were talking about how, and definitely teenagers absolutely more willing to kind of disclose to their friends as opposed to their parents, or say, don't tell mom and dad.
Right.
But, so do you have any advice for, a friend or a teenager who may be concerned about a friend or a peer?
Yeah, I think it's really important. I've had a couple of situations recently where a mom has called because their child has come to them because their best friend has told something and they don't know what to do with that information. So I think that's why it's really important to have the conversations about that, and they don't want to break that trust. They don't want to break that friend-to-friend trust that they have. I think it's important to have to report it. I think it's important that you encourage that child to talk to that other child about having the conversation and bringing that forward. Because they often get in difficult situations, and if they're not, we try to intervene at a level where they're not getting into, drugs or, promiscuous behaviors or things like that. So we've really seen that intervening and wrapping services around these kids helps in the long run for their healing.
Sure. Now, I've heard statistics that say that child sexual abuse most often happens with a family member or close relative. Is that true? Does that continue to be true?
We see about 90% are someone they know, love, and trust. It's not the person jumping out of the bushes. And it's based on opportunity. So, it's when kids are home, or, we see a lot of, unfortunately, it's stepfathers, fathers, uncles, people visiting, cousins, a lot of sibling on sibling abuse, because I think it's cyclical and they're not, these kids aren't getting help and they're just reoffending on other kids.
Indeed. Now, of course, one of the other big issues that we have to deal with here on the Cape is the substance abuse crisis. Alcohol abuse here has been labeled endemic, or we're seeing a rise in opiate use, and there are concerns that, children who were sexually abused and perhaps didn't properly deal with that trauma have turned to substance abuse to try and self-medicate. And is that something, I would think that's a big concern.
It is. It's always been a concern for us, and I think the rise is absolutely contributing to all of it. So, the rise in the, child sexual abuse alone, and the exploitation and trafficking piece of it, it all goes hand in hand. Child sexual abuse, kids who've been through a traumatic event like that are 26 more times likely to abuse alcohol and drugs. It's something that we really have to intervene when it's happening or early on in their life to be able to assist with something like that. But we see it with our cases all the time. We see it with caretakers that are coming in with addiction, and they may be survivors of child sexual abuse as well. And we always hear from, especially moms coming in, that where were you 30 years ago or 20 years ago when I was abused? I didn't have this opportunity to get that help. And now they are addicted to drugs, and their children are going through the very same traumatic events.
Absolutely. So important, again, another important factor as to why you should get help right away.
Right.
And again, so remind me how people can get in touch if they have concerns, if they have questions, if they would even just like to talk to someone about the issue.
They can call our general phone number at 508-375-0410 and talk. It's literally having a conversation and saying, I think something's happening with my child. I'd like to have a conversation with somebody. We get those calls all the time. And it may not be a situation where we move to an investigative, response or even a mental health referral. It's just maybe having that conversation with this caretaker to give them some information. And again, our website, childrenscove.org, has a lot of that information on it, so it's really helpful to caretakers. One of the things I wanted to be mindful of is especially that caretakers call us all the time and say, I don't know how to start the conversation. We literally have the words to use to talk to your kids about that, because it's that important to talk to your kids early on about this stuff.
Absolutely, and I can imagine, how would you talk to your kids? It's just a really difficult thing to think about. And I think another challenge is prevention. I would think that, obviously so often this is something that happens behind closed doors in a very intimate environment between people who are already close. So what can be done, or what has Children's Cove been working on in terms of prevention?
I think you have to be really aware. I think you have to be aware of what your children are doing, and I think that with families working so much more and kids being home alone or with other siblings, I think it's really difficult these days, and We say, especially with online cases that we see, internet cases, we see them all the time. Everybody has an iPad. Every kid has an iPad or an iPhone, and parents just don't know what they're doing on that. And it's so important to know or to have some kind of security on those devices, because kids are looking things up and they're finding things on the internet that they should not be seeing at an early age. I see it with my own kids in their peer groups, and they know how to do things on devices that we just don't know how to do. So it's important that I think that security is taken, and that you know where your kids are, you know who your kids are hanging out with, and you're having those conversations. Prevention and training is really important to us, so we're constantly out in the community talking to people about preventing child sexual abuse. We're out in community agencies. We train law enforcement, in talking about the exploitation and trafficking piece. It's about constant awareness of this epidemic, because it does happen here.
So we've talked a lot about the kind of localized child sexual abuse, but you mentioned at the beginning sex trafficking, child sex trafficking. I feel like this is definitely something people say that doesn't happen on Cape Cod. That's only in foreign countries, and it doesn't happen here, and that's just not the case.
Right. It's not a Southeast Asia problem. It's here. So, just as much as it's difficult to talk about child sexual abuse, people cannot imagine something like exploitation and trafficking, or kids being sold online in our own communities and being trafficked for sex in our own communities. But it's happening. We see the cases. And it's not just happening with kids that are in the system. It's happening with all kids. So again, we go back to the internet and talk about, kids, just searching the internet and in chat rooms and talking to people that they're going to go out and meet, and they have no idea what's going to happen. And there are exploiters out there waiting for these kids. And not to scare people, but it's something that's very real in our community. So we are, in an exploiter's mind, we are a great place to exploit children, because we are a summertime vacation destination spot. So kids are coming from Boston and New York and being trafficked to Cape Cod and back and all around. And you can find kids being sold on various sites, and that's what's happening. And I know it's really hard to get your head around, but 70 to 90% of these kids have some child sexual abuse traumatic history. So again, going back to catching these kids, when some kind of traumatic event happens, is really important.
And what I'm hearing too is really, as parents, we need to watch our children's use of the internet. I think that, it's something that is really very new in the grand scheme of things. And as you said, the kids have so much more of a knowledge than the adults do. And it's kind of terrifying what's out there. So I think that's one thing that parents and even friends can be vigilant and really limit that internet use, or at least be aware of what sites your kids are visiting.
Yeah, and it's really difficult, because we know that parents can't watch the kids 24/7. But there are ways to be very restrictive on their devices and to check what they're doing and to see what they're doing when they're hanging out with friends. But again, we can't watch them 24/7. So it's a tough job. But I think the number one step is awareness that these things are out there and that these things are happening, and to not really think that it doesn't happen in my world, because it's really important for our kids.
So Stacey, again, if people want to know more about Children's Cove, if they have questions, if they'd like to find out more, what's the best way for them to do so?
I think the best way is to call us directly, certainly if you have questions. We can navigate a lot of systems and help people through if they have questions about their kid or behaviors or things like that, at our phone number at 508-375-0410. Our website has a wealth of information at childrenscove.org. Specifically talking about how to talk to your kids. We have great resources on there. We have videos that kids can watch. We have the information about exploitation and trafficking on there. So it's really some good information that's not overwhelming either.
Wonderful. Well, Stacey, thank you so much for joining me today. Really wonderful to talk with you.
Great. Thanks for having me.
Thank you so much. Stacey Gallagher is the director of Children's Cove. You can visit them online at childrenscove.org. I'm Sarah Colvin.